Hello everyone. Today the topic of my discussion is hypertension. So hypertension it is a condition of the persistent constant elevation of blood pressure. So before knowing what is hypertension, we should know about what is blood pressure. So mainly our body it require blood pressure, mainly pressure in the blood to pump the blood from the toe, from the heart to the toe, from the heart to the brain. So mainly our normal blood pressure it is 120 by 80 mmHg. So mainly the blood pressure, it's a pressure exerted by the blood on the wall of the arteries. So we can see in blood pressure we have two terms, that is 120, which is denoted as a systolic blood pressure. It is a blood pressure when our heart is contracting and pumping the blood to all parts of the body. And diastolic blood pressure, we can see 80 mmHg. That's a diastolic blood pressure when our heart is in the relaxing condition, and from all parts of the body deoxygenated blood it comes into the heart. So mainly hypertension is a condition where our blood pressure will be elevated constantly. It is more than the 120 by 80 mmHg. So mainly blood pressure we can classify it into different stages. So first one is the pre hypertension, which is denoted as from the 120 to 129 mmHg systolic and 80 by 89 diastolic. And next one is a stage 1 hypertension, where it is 140 to 159 mmHg is a systolic blood pressure, and diastolic pressure will be 80 to 89 mmHg. And stage 2, which is the dangerous condition where our blood pressure will be more than 160 mmHg and our diastolic pressure will be more than 100 mmHg, and we require medical treatment for all the mainly the stage 1 and stage 2 condition. Next is the symptom. Mainly we can see the different symptom in hypertension, like fatigueness, the blood vision, then headache, then we will be having fainting, weakness. So these are the different symptoms of hypertension. There are two type of hypertension stages. Stage mainly the primary hypertension, which is also known as essential hypertension, and mainly the most of the people are suffering from primary hypertension. The cause is unknown, and it is the combination with lifestyle, diet, and even it is genetic. Second one is secondary hypertension, which is due to some underlying disease like we have some, if people are suffering from thyroid disease and they are taking some other medications, then a renal problem. So these all leads to the secondary hypertension. Then mainly in our body there are some mechanisms like RAS mechanism which get activated, and once it get activated in the body, that will create the hypertension. So mainly to know more clear about the hypertension, so I'll just tell you about briefly what is this RAS mechanism, renin angiotensin aldosterone system. So in our body, if there is any fluctuation in the blood pressure, so even our all the organ perfusion, blood perfusion also will be reduced. So even renal perfusion will be also reduced. So once the renal perfusion is reduced, our kidney will start releasing renin, one enzyme. So once the renin goes to the circulation, in our body already angiotensinogen is present, that start converting into angiotensin 1. So one angiotensin 1, it passes from the lungs. There is one enzyme, angiotensin converting enzyme, that start converting angiotensin 1 to angiotensin 2. And this angiotensin 2 is the main, we can say, culprit to increase the blood pressure in our body. So angiotensin 2, it start binding with angiotensin 2 receptor. We have two type of angiotensin 2 receptor in the body, angiotensin 2 1 receptor and angiotensin 2 2 receptor. Mainly all the elevation, constant elevation in the blood pressure we found because of the action of angiotensin 2 1 receptor. Till date, angiotensin 2 receptor function is unknown. So once the angiotensin 2 receptor, it will bind to angiotensin 2 1 receptor, it will do so many different pharmacological action. Like first, it will increase the sympathetic activity. So once sympathetic activity will be increases, we can see there will be the elevation of blood pressure in the body, there will be the increased respiration rate in the body, and even heart rate increase, and that leads to the increase in the blood pressure. Secondly, it will increase the aldosterone release. So this aldosterone, it will be released from the adrenal gland, and it will act on the last part of the nephron, that is collecting tubule, and it will start reabsorbing the water and sodium in the body. So once sodium and water will be retained in the body, it will increase the blood volume. So once blood volume is increased, there will be the elevation of peripheral vascular resistance, and in turn we can see there will be the increase in the blood pressure. So these are some pharmacological action, or these are some different action which will be elevated due to the RAS mechanism. This is a physiology of blood pressure by the RAS mechanism, and our most of the antihypertensive drug, they act on this RAS mechanism. So we have different type of antihypertensive drug which is used for the treatment and management of blood pressure. Mainly the five starting different drugs, they act on this RAS mechanism itself. First category is ACE inhibitor. This is angiotensin converting enzyme inhibitors. Examples: enalapril, captopril, ramipril. Mainly they inhibit this angiotensin converting enzyme inhibitor, and that will be inhibiting the production of angiotensin 2 inside our body. As I told you, that is the main reason to increase the blood pressure. Our second category is angiotensin 2 receptor blockers. So mainly these category of the drug examples, it's telmisartan, losartan, candesartan. These drugs mainly inhibit the binding of angiotensin 2 receptor blocker. So once the receptor will be blocked, the action will be also blocked, and we can reduce the blood pressure. Third category is diuretic, which is diuretic examples: hydrochlorothiazide, chlorothiazide, then we have furosemide, spironolactone. So all these drug will be inhibiting the reabsorption of water and sodium in the body, and we can inhibit the blood volume by inhibiting the water and sodium retention in the body, and in turn we can reduce the blood pressure. Third category is calcium channel blockers. So mainly we can see this calcium ions are play very important role in the contraction of the myocardial muscles, and once we block this channel in the heart and in the smooth muscles, we can reduce the contraction, we can depress the myocardial contraction, and in turn we can reduce the heart rate, cardiac output, and we can reduce the blood pressure. Next category, we have different types of adrenergic receptor which play a very important role in reducing, or we play important role in the reducing of the blood pressure. We have beta blockers like atenolol, propanolol, timolol. Then we have adrenergic blockers. Then we have adrenergic and beta blockers. Then we have centrally acting drug methyl dopa and clonidine, which act directly on the central nervous system to reduce the blood pressure. So with this, I conclude my today's topic, and next session I can give you more information about this. And if you have any doubt, you can leave comments, and I will try to reply you as soon as possible. Thank you, everyone.